So the main objective of the South Yorkshire Digital Health Hub is to gather together a community of practice. That's all the stakeholders involved in digital health. Anyone who wants to create some kind of digital health hub. And the idea is that we give them the skills required to create apps and tools that will actually be successful and actually be used in the NHS. What we want to do is we want to start right at the beginning and ask the people for whom they're designed. That's the patients and the public. So what is it you want? Help us co-design the things which will actually work for you. We're surrounded by the population we want to influence, we want to help. And we've got all these co-locators of all sorts of different flavours, whether they're engineers, whether they're practitioners, and we have patients coming through the building as well. So we have all the people here ready to work with to achieve the aims of the Digital Health Hub.
The Hub will drive digital innovation. We've seen rapid adoption of digital technologies in the NHS as a result of the pandemic, but there's still so much more to be done. And the Hub will help us to achieve that. It will bring teams together to look at the real problems that digital technologies can solve. It'll also help to engage lots of people and help them feel more confident with digital technologies. People will start to think differently about how digital will be able to help us in healthcare.
Google knows we are the best when we are working at the intersection of academia, public services and industry, bringing our expertise and combining it with those, and the South Yorkshire Digital Health Hub absolutely speaks to that. We are delighted to have gifted 500 digital skills scholarships to the Hub. Soon there'll be 500 Fitbits arriving and hopefully more in the future, where we'll be putting those onto the wrists of local people so that we can start to understand population health in more detail. Coming to an area like South Yorkshire and Sheffield specifically, where there are really lots of health inequalities, means that Google can really do what it's best at, which is invest in local communities and drive improvements for all.
I've been a doctor for 30 years and I've never known the NHS face as many challenges as it faces today. What the Hub will do is develop new technologies that allow us to find out more about someone's quality of life, their symptoms, their activity, their environment, and combine that with the data that exists in the NHS systems to compare it against hundreds of thousands of people to really work out what's the right treatment for them, what disease do they have, what's going to happen to them in the future so that we can do things to improve their outcomes.